All right, good morning, everybody. It's about 9:04 on Tuesday, August 31st, 2021. We are going to call to order the Monterey County Board of Supervisors for the Water Resources Agency. Could we get a roll call, please?
Good morning. Let the record reflect all supervisors are present, with Supervisors Alejo and Lopez appearing via video conference and Supervisors Root Askew, Adams, and Phillips appearing in person.
Wonderful, thank you. Are there any additions or corrections to our closed session Water Resources Agency agenda today?
There are none today, Chair.
All right. We have item number 1A on our Board of Supervisors of the Monterey County Water Resources Agency today for closed session. Is there any public comment on closed session for Water Resources Agency today? If you're on Zoom, you'll need to press the raise hand feature. Anyone in the audience for closed session? Okay, seeing none, we'll close closed session and we'll recess to closed session. We will close public comment and recess to closed session for agenda items for the Monterey County Board of Supervisors for the Water Resource Agency, and we will call to order the Monterey County Board of Supervisors. Could we get a roll call, please?
Good morning. Let the record reflect all supervisors are present, with Supervisors Alejo and Lopez appearing via video conference and Supervisors Root Askew, Adams, and Phillips appearing in person.
Are there any additions or corrections to our closed session agenda this morning?
There are none today, Chair.
All right, thank you. Today, the Board of Supervisors has item number 1A through F on our closed session agenda as listed on the agenda. And we would like to welcome any public comment for a closed session for the Board of Supervisors this morning. And we're gonna stick with our 90 seconds for public comment. So thank you for joining us, and make sure the microphone is turned on. And we'll start with the audience and then we'll move to public comment on Zoom. So if you are on Zoom and could raise your hand now, if you plan on making public comment, that would be helpful. Thank you for joining us.
I'm not entirely sure how to determine if the microphone is on.
It should be on already.
Yeah. Thank you.
Sorry, it's technological, so I really don't know. Forgive me. Hello, my name is Elizabeth Tyler. I've been working with Monterey County Children's Behavioral Health for 20 years on September 11th on the juvenile justice team, providing therapy to juvenile offenders and their families. I'd like to speak today about our healthcare insurance, and I'm not seeing a countdown, so.
Yeah.
Sorry.
Yep, new technology, we're working on it.
Hey, I feel that.
We'll roll with it, thank you.
Thanks. So I have always chosen the HMO Select plan during my tenure with the county, and it has really come through wonderfully for me and my family. There's been several surgeries and hospitalizations that have been covered, and I've been really grateful. And right now, the proposal on the table, if I maintain HMO Select, indicates that I will basically take a pay cut of $2,000 in the year 2024. I don't want to take a pay cut. It's not easy. It's not comfortable. And I don't want to feel like my work is worth less. So I would ask the board to partner with us. We are having a significant recruitment and retention issue, in part because of this. Partner with us to maintain our safe and social security net for all the vulnerable people in our communities. Partner with us by directing your CAO and your negotiating team to put a proposal on the table that honors and respects our healthcare insurance and helps us to retain more people like me for 20 years and to recruit more people to fill the innumerable vacancies on my team alone. And see you next week.
Thank you, Elizabeth. And thank you for your patience with our new technology timer we're testing out today.
It's nifty. Hi, everyone. My name is David Rosen. I'm the Vice President for the Monterey County chapter. I'm also a social worker with Monterey County Family and Children's Services. I wanted to talk with you guys about equity. Last week, during my public comment, I talked a little bit about the fact that we have a significant amount of people within our bargaining unit that live under a living wage. Something that I really wanted to emphasize is when I say 49% of families that are two adults, two children, we're talking about families that have often people of color. When I'm talking about single people who are under the living wage, I'm talking primarily women and people of color as well. When we're talking about equity and needing things like health insurance, we're talking about single mothers, we're talking about single parents, we're talking about people who don't often have access to healthcare. These are important things for us. And the reason that we are really pushing for PERS Platinum is because it has a network that works for our, not only for our members, but for the people that really need it the most. For me, as a single white male, it may not matter racially. However, as somebody who represents 3,200 other people, I understand the fact that this is the type of thing that we live in a rural society. We live in a place where there's not a network, and we need to make sure that we have a coverage that works for everybody because equity matters.
Thank you, David. Is there any other public comment in the audience today? If you could approach the podium, otherwise we'll move to Zoom. Right, and I'll just make note that we do have a handful of people here present, it looks like, supporting SEIU. So we'll move over to our Zoom comments, and I have Dorian Manuel. Dorian, we have a minute 30 on the clock. Thank you for joining us today.
Of course, thank you for having me. My name is Dorian Manuel. I'm the case manager for the Monterey County Safe Parking Program. We have some folks over at the First Avenue lot, which have been.
Dorian, it looks like you're unmuted, but I'm not seeing, we're not hearing you at this point.
Oh, geez.
All right, let's try Dorian again in a moment. Let's move on to Cynthia Benitez.
Madam Chair, can you hear me?
And Cynthia, you'll need to manually unmute your microphone.
Can you hear me?
All right, we're still not getting any audio for Cynthia.
Wait.
Cynthia? All right, let's move on to Karen.
I'm here.
Cynthia,
Can
are
you hear me?
here? Yep, we can. Okay, great. Would you like to share your public comment with us? We have a minute 30 on the clock for you.
Okay, thank you. My name is Cynthia Benitez. I have been working with the Monterey County Health Department Clinic Services as a patient service rep for 16 years. As I am sure you know, we are exhausted. We are very exhausted at our clinic services right now. This pandemic is still raging, and we are seeing up to 60 to 80 people a day coming into my work area, and we are understaffed and everyone is burned out. I have been grateful to have good health care with the county. I'm on PERS Choice, and it has really helped me when a time when I was hospitalized for over a week a couple of years ago. But right now, the CAO is proposing to shift healthcare costs onto the employees, as well as offering only a small increase in wages. As a result, in 2024, people making under $66,000 with PERS Choice who are covering their spouse or families will be taking a pay cut on average of $600. So I am asking the Board of Supervisors to please help us by letting the CAO know that this proposal is not workable. We are already understaffed in our clinics, and we need a proposal that will attract more people to come and work here. This proposal is not it. Also, too,
Oops, Cynthia, sorry to cut you off. I would absolutely encourage you to send an email with your additional talking points to the board at cob@co.monterey.ca.us. We do appreciate all of the comment, and I apologize for the ding. Next up,
okay, no problem.
we're going to try Dorian again. And Dorian, we were having some IT challenges. It sounded like you were audible on Zoom, but we weren't hearing you here in chambers. So Dorian, we're going to circle back to you and try this again.
All right, hopefully you can hear me now.
We've got you now. Thank you, Dorian. Thank you for your
Lovely.
patience.
My name is Dorian Manuel. I'm the case manager for the Monterey County Safe Parking Program. As many people are aware, we have some folks parking illegally that aren't members of the Safe Parking Program over at the First Avenue parking lot, and I've been working with social services to try to offer them some services. It's been somewhat of an issue trying to conduct our regular program due to the lack of space for participants of the program. And that has been a real issue, but I would like to encourage the board to try to find some permanent solutions for this type of problem, because I have been seeing that so many of the homeless services in the county are stretched so thin. A brand new shelter just opened in Salinas and filled up almost immediately. And my heart really goes out to all the folks that are there and not willing to give up their spot, because there really is nowhere for us to send them if they're not able to stay there. It has definitely been an issue of trying to balance our program with the plight of these people. But I sure do hope that we're able to find some sort of solution to help these individuals, because they are, at the end of the day, just vulnerable members of our community and our neighbors. Thank you. I yield my time.
Thank you for joining us today, Dorian, and for your public comment and your patience with our technology. Next up, we have Karen Pontius. Karen, we have 1:30 on the clock for your comment this morning.
Can you hear me?
We can. Thank you for joining us.
Thank you. Hi, my name is Karen Pontius. I've worked with the Monterey County Environmental Health Department for 6 years and 5 days. So I am on the HMO Select plan, which has been absolutely fabulous for me and my husband because I've had multiple surgeries. I'm a cancer survivor. So it's really crucial for me and my husband to be on that typical plan. I'm really grateful for the county's healthcare services. And other than my love for the public, being a public servant, the healthcare is one of the main reasons that I've stayed with this job. Unfortunately, I understand from the CEO's current proposal that they plan to shift this healthcare cost onto the workers while only giving a very minimal wage increase. And it looks like from what the numbers show that we're going to be taking about a $2,000 wage decrease. Well, only getting a 2% wage increase. And what I ask you is to please go back to the CAOs and come up with a plan that actually works. You've provided great health care in the past, and I just plead with you to please keep doing that. I love working for the county, and I really wouldn't want to have to go anywhere else. Thank you for your time. Bye-bye.
Thank you for your comments today, Karen. Is there any other public comment this morning for the Boards of Supervisors closed session agenda? I'm seeing no additional hands raised and no one approaching the podium here in chambers. So we will go ahead and close public comment and recess for closed session agenda items for the Monterey County Board of Supervisors. We will reconvene back here at 10:30 a.m. for the remainder of our agenda. Thank you for joining us.
Testing, mic number 2, testing, mic number 2. Testing, mic 2, testing, mic 2.
That's better. Okay.
Mic number 4, mic number 4. Mic number 6, mic number 6. Mic number 8, mic number 8.
Clerk's mic, clerk's mic.
Mic number 11, mic number 11. Mic number 12, mic number 12. Staff mic 1, staff mic 1. Staff mic 2, staff mic 2.
Wireless 2, wireless 2.
Yeah. Podium mic, podium mic.
Wireless 1. I know, I wasn't up for the evening. Like they should offer it to the same time. I feel like sometimes it is like that they'll both open together. They're open and I try and rush in. But this time by the time I called, the other one was already. Yeah, I was looking forward to it, but I didn't get. Okay, I'll look out for that one. Try to call it, but I don't get the email. And one time I did catch it. Like, they're like, no, it hasn't been assigned. You want? I was like, yeah. And he checked it, like, oh no, there's not enough time between. Trust me, I can have.
All right, it is, let's see here, 10:36 on August 31st, 2021, and we are going to reconvene the Monterey County Board of Supervisors. Could we get a roll call by the clerk, please?
Good morning. Let the record reflect all supervisors are present, with Supervisors Alejo and Lopez appearing via video conference, and Supervisors Root Askew, Adams, and Phillips appearing in person.
Fabulous, thank you. And once again, we are going to try to work with everyone's camera on today so that we can pin the supervisors' videos to our Zoom screen so that the audience can participate more closely with us as they would if we were all here in person. And we will just also ask, we're trying out a new timer feature, so we'll just ask for everyone's patience with our technology that we continue to upgrade today. I want to welcome Jocelyn Martinez, who's here as our Spanish interpreter. Jocelyn, would you make our announcement of Spanish interpretation available?
Buenos días, Jocelyn Martínez, intérprete de español. Se les anuncia que le bienvenimos su comentario público en español y tendremos servicios de interpretación disponibles. Gracias.
Thank you so much. And we do have Spanish interpretation available in chambers as well as on Zoom. And our Zoom webinar ID number is 224-397-747. I'm pleased today to welcome Dan Presser, who's a board member with the Monterey County Fair, to lead us in the Pledge of Allegiance. We are excited to have the Monterey County Fair back September 3rd through 6th at the fairgrounds in Monterey. Thursday, August 2nd is Seniors Day, where individuals 62 years old and better can enter the fair for free all day. Thursday is also Military and Veterans Day. Thank you so much for joining us. Dan, would you like to lead us in the Pledge of Allegiance this morning?
Sure would. Before we get into the pledge, let's take just 20 seconds, one for each year that we've been in Afghanistan, to honor those 13 who gave their lives for America. We recall too those who perished over the years, with those who returned wounded and those who returned with PTSD. So just 20 seconds, please. Thank you very much. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much.
Thank you so much, Dan, for joining us and for taking that brief moment of reflection. We will be adjourning our meeting today with comments from our Military and Veterans Affairs Officer, Jason Cameron, recognizing the service members who've lost their lives in Afghanistan recently, as well as over the past 20 years. So really appreciate having you here today, Dan. It's very special. And we'll see you at the fair. All right. Are there any additions or corrections on the public agenda today?
There are no additions and corrections.
All right. We're going to move on to our ceremonial resolutions. We have ceremonial resolutions number 2 through 5 on our agenda. I'd be happy to entertain a motion and then we'll move on to presentations.
Move approval of the resolutions.
Second.
All right. We have a motion from Adams, a second from Phillips. Is there any public comment on our ceremonial resolutions this morning? Seeing none, we'll close public comment on ceremonial resolutions and bring it back to the board for a roll call vote, or bring it back to the clerk for a roll call vote.
Supervisor Alejo.
Aye.
Supervisor Phillips.
Aye.
Supervisor Lopez.
Aye.
Supervisor Adams.
Aye.
And Chair Supervisor Root Askew.
Aye. All right, our ceremonial resolutions have all been approved, and we will begin with item number 2, which is to adopt a resolution in appreciation of Coastal Home Kids Care and declaration of Childhood Cancer Awareness Month. I am presenting that, and we have 2 guests with us here today. So I will, let's see here, step down and use the microphone. All right, and that's our camera right there. All right, and this is a resolution in appreciation of Coastal Kids Home Care and declaration of Childhood Cancer Awareness Month. Childhood cancer is the leading cause of death by children, by disease in children, and hundreds of nonprofit organizations at the local and national level are helping children with cancer and their families cope through educational, financial, and emotional support. Coastal Kids Home Care is a trusted community partner providing home pediatric medical care to children with cancer and supportive services to their families here in Monterey County. The Board of Supervisors of Monterey County, on behalf of the county and our residents, declare September as Childhood Cancer Awareness Month in Monterey County and honor Coastal Kids Home Care for your outstanding support to our community and our families when they have great need. Thank you so much. And we're so grateful for the services that you offer. All right, our next resolution here, actually get the microphone back. All right. Next up, we have item number 3, which is a resolution honoring Executive Director Deborah Hale upon her retirement from the Transportation Agency for Monterey County. And I'm going to pass the microphone over to Supervisor Adams. And Deborah's online, so we can maybe, whichever you're most comfortable with.
Well, I'm always comfortable with the microphone. Thank you. I'll wait for the resolution though before I'll start my remarks, although I guess I can go ahead and start by saying that obviously, Debbie, this resolution comes from the entire board and many board supervisors from the board who have gone on, because you've worked with all of us for so many years in the leadership role that you've had at TAMC. All of us have had the opportunity to share in the leadership style that you have and in the many good works that you have provided for all of our districts. So with that, I'll go into the actual language of the resolution. Whereas Debbie Hale has worked in the field of regional transportation planning since 1990, specializing in project management, grant funding, public involvement, and collaborative decision-making. And whereas Debbie Hale has served the Transportation Agency for Monterey County for 20 years in total as transportation manager, then deputy director, and then executive director for 15 years. And whereas Debbie Hale was instrumental in the establishment of the Measure X Transportation Safety and Investment Plan in 2016, which leverages matching monies to deliver a $1.5 billion integrated program of projects as approved by 67.71% of Monterey County voters. And whereas Debbie Hale and the Team TAMC staff delivered a variety of programs and projects focused on making it safer and easier for travelers of all ages and abilities to get around Monterey County. And whereas Debbie Hale has played a pivotal role in expanding public outreach and partner coordination, including the creation of an interagency construction task force, which has become a model for all of the agency's projects, and the development of an innovative public education and outreach campaign for the Holman Highway 68 roundabout that is emulated by other public agencies for their projects. And whereas Debbie Hale has been an active community leader in organizations such as the American Public Works Association, the WTS San Francisco chapter, and Rotary International, gaining recognition for her role in representing TAMC and Monterey County on statewide and national levels. Now, therefore, be it resolved that the Monterey County Board of Supervisors, upon the occasion of Deborah L. Hale's retirement from service as Executive Director of the Transportation Agency for Monterey County, hereby recognizes her many years of exemplary service to the region and proclaims its most sincere appreciation for her efforts to advance transportation in Monterey County. Thank you so much for all of your years of work. I have an expectation that a couple of my colleagues might want to say just a congratulatory message as well. And I'll look first on site here and see if Supervisor Phillips would like to make a comment.
Yeah, Debbie, it's been a pleasure working with you and learning from you as we went along. I know we worked together. I was co-chair when we did the Measure X, and the way you worked and pulled that together was amazing. So enjoy your retirement, and thank you for all your hard work. You've done a heck of a job of putting the agency in a great position. So.
Supervisor Askew.
Thank you. And Debbie, it's just been an absolute honor to work with you these past 13 years. And I wish you the absolute best in your retirement. You're leaving us with a strong organization, a great team. And I think our region is, I hope that you feel like you've left a legacy that you can be proud of.
Supervisor Alejo.
Thank you. as the past chair of TAMSI, but also I think all 5 county supervisors served on the board of directors during our times as in office. And it's a great pleasure and even sadness seeing Debbie Hale leave, a total professional, a really talented leader of an important agency that addresses some of the greatest priorities that all of us hear from in our offices, and that's fixing our roads and highway systems, pedestrian paths, walkways for all residents of all ages to enjoy. And Debbie has really kept true to her commitment to address needs of every community throughout Monterey County, every person, every age, every color. And so Debbie, it's well-deserved. It's a bittersweet moment celebrating your well-deserved retirement, but certainly having somebody with your knowledge and your experience and your political know-how of getting difficult projects through a very arduous and lengthy bureaucratic process is not an easy thing to accomplish. And you were a great ambassador for TAMSI, dealing with Caltrans, with legislators in Sacramento. I know I work with you there on legislation as well. So I want to just wish you well and really thank you for doing such a good job in Monterey County and also bringing in a very talented staff. So I'm sure with your training and your kind of mentorship of folks that the team will keep going and carrying out the work that you were so committed throughout your career. So thank you very much. And I think we can't ask for any more from you. You've done a lot for us, and it's very much appreciated by all of us. So on behalf of my constituents in Salinas, we wanted to just express our gratitude and thanks to you.
Thank you. Supervisor Lopez.
Thank you, Mary. After a decade and a half, Debbie, of working together, I appreciate you more than you know. I know that oftentimes we were pushing in the same direction, and it was difficult conversations, but at the end of the day, what we were left with is an incredible infrastructure throughout Monterey County that would not be in the condition it's in today or have the opportunities that still lie ahead of us, like the South of Salinas project, without your leadership. And so I know that you're leaving us in great hands. You've built an incredible team with a lot of succession planning and cross-training that you are leaving us in the hands of, and we appreciate that vision as well. And so I'll say that this retirement is extremely well-deserved. We wish you the best and know that you won't be too far away. And hopefully we'll see you in some other capacity soon, but wishing you a relaxing and long and enjoyable retirement.
Thank you. And I also want to say, Debbie, that I will continue to think about you every day, even though you're gone, as I drive through my beautiful home and Highway 68 roundabout. Thank you for the efforts that you made on Measure X, which has absolutely resolved so many traffic problems that we've had throughout Monterey County. It's been a pleasure to work with you. And one of the best things about your retirement is that you have many years ahead. So you've got a good start. So thank you. And I'm hoping that we'll make some comments for us now.
Well, thank you, everyone. And I just want to say that as you look around the state and you see what agencies such as TAMSI have been able to accomplish, one of the keys is having a great team. And first of all, not everybody may know, but all 5 of the supervisors sit on TAMSI, and we couldn't do it without your support. And TAMSI is known for playing nice together. That doesn't mean there aren't disagreements, but I really appreciate your dedication to working together to get things done, because it doesn't always exist around the state. I know I also have a lot of staff members tuning in, and I really appreciate the kind comments and about Team TAMSI, because our motto is that everybody makes it happen, and you don't get to take vacation unless somebody backs you up. And so we all work together on everything, and I'm just thrilled to death that Todd Muck will be succeeding me as executive director. We're a small but very productive agency, and I'm proud to say that there were a lot of controversies before I came, and maybe I was just lucky that those set the stage for things like the Prunedale bypass and Hatton Canyon set the stage for saying, okay, if we want to get things done in this county, we need to work together. And so I'm really proud that we've been able to work together to get things done. I appreciate the partnership with the County Department of Public Works as well, and I'm glad you got some money to work with now. So for those of you that are wondering, I'm going to be moving on to probably full-time volunteer work. I'm going to be planning, funding, and building projects with Rotary in Monterey County and the District 5230 that extends into Fresno and Tulare and Kings County. And so I hope you will see me around and about doing good works for people in other realms besides transportation. So thank you all for the privilege of working with you. And I know that Todd can count on your continued support to get things done. Thanks so much.
Thank you, Debbie, and we'll be sure to get the resolution delivered to you. Thank you so much.
Thank you, Supervisor Adams. Next up, we have a resolution proclaiming August 31st as International Overdose Awareness Month. And I'm going to pass the microphone over to our Health Department Director, Elsa Jimenez, to make some comments for this resolution.
Hi, good morning. Elsa Jimenez, Director of Health. And sorry you caught me off guard. I'm actually going to hand it over to my team to begin the presentation of the resolution. So let me hand it over to Rose Moreno, who's going to introduce our speakers for today. So thank you again for moving this forward.
Rose, you're on mute.
Okay, can you all hear me?
Yes.
Hi, good morning, Supervisors, Chair Askew. First off, I'd like to thank you for recognizing August 31st is International Overdose Awareness Day. This day that is internationally and locally now recognized for raising awareness about the risks of overdoses. It honors individuals whose lives have been lost from substance use overdose and acknowledges the grief felt by families, friends, and communities. In our community in 2020, we lost 108 residents to overdose. The Health Department and Behavioral Health Bureau have developed long-lasting collaborations with not only our contracted providers, but have been a part of the Prescribed Safe Monterey County initiative since its inception, which really is aimed at reducing not only overdose deaths, but overdoses in our community. I'm going to introduce Dr. Reb Close first, who leads our Prescribed Safe Monterey County initiative, and shortly after I'll introduce Catherine Eckert, our Behavioral Health Bureau Chief. Dr. Close.
Thank you. It is absolutely an honor and a privilege to be here today. Thank you, Supervisors and Chair Root Askew. This is an incredible pleasure and honor to be here with everyone today. It is truly with just such tremendous gratitude and humility that I wanted to express my deepest appreciation to our Monterey County Board of Supervisors, but as well our partners at the Monterey County Health Department on this really momentous day, when we come together and realize that International Overdose Awareness Day, as the world's largest campaign to raise awareness, we're able to raise that awareness in our local community. And what I want to make sure that we continue to do is to raise that awareness for our overdose survivors, those we have lost, the families affected on all sides, and to do that without any chance of stigma. Our community needs our open arms and our acceptance of where they are as we fight this together. And so I just wanted to say thank you. I am so honored and grateful for this resolution and for all of the support over the years as we work together on this as a team. So I appreciate the time and I appreciate all of the efforts, and I am very grateful for our collaboration.
And Catherine Eckert is our Behavioral Health Bureau Chief.
Good morning, all. I just wanted to share, some of the reflections that I have when I think about the opioid epidemic in our community. We all know that opioids are prescribed to treat pain. Many of us have used them. We're still learning how addictive they are, despite being marketed as safe for years. And people get addicted through no fault of their own. People from all walks of life are affected. People from all economic levels are affected. Our community, our neighbors, our friends, our families, and maybe even ourselves. I can guarantee that each of us knows someone who we care about who's been addicted. We all are affected by this opioid epidemic. And we all need to focus on compassion and helping our friends, our neighbors, our families, and perhaps even ourselves get our lives back and get treatment and prevent needless deaths. So I want to say thank you for supporting International Overdose Awareness Day and spreading this message about the tragedy of overdose death, allowing time for us all to mourn, and moving towards preventing drug overdoses in the future, and treating all of us, ourselves, our community, and the individuals that we know who have been affected by this addiction with compassion and hope.
Thank you, Catherine. We do have a few board comments, and I see Supervisor Phillips. We'll start with you and then move to Supervisor Lopez.
Yeah, I just wanted to kind of reach out and thank Dr. Reb Close. Her prescription safe assists with overdose awareness, and she's been instrumental in helping us bring awareness out there in North County. And even when we tried to lobby our local pharmacist, we only have 2 in Prunedale to put the disposable bins in there. They wouldn't do it, so we worked to do it at the library, and we got that pointed. But I really do appreciate you keeping us and awareness on the criteria for you. So thank you a lot.
And Supervisor Lopez.
Yeah, Rev and Casey, I'm sorry, Dr. Close and Dr. Grover have been extremely incredible over the last few years in helping us get the word out, helping to get Narcan into our communities to make sure that in that worst case scenario, our communities are equipped to respond and to be part of that necessary, unfortunately, in the epidemic that we're living in solution. And we do have a prescribed safe bin here outside of our office in Greenfield. So encourage people to do what you can, educate yourselves, and know that you're not in it alone, whether you're a family member or somebody going through addiction. Stigma, as Dr. Close said, is something that we all need to work to get rid of. But it is a community-wide problem, as Katie said, we're impacting all of us. And so as we go through this epidemic, as we continue through it together and continue to see headlines about fentanyl overdoses and understanding the challenges of counterfeit pills and how that can negatively impact our community, it's important to be educated and equipped. And I want to thank Dr. Close and Dr. Grover for helping us continue that conversation, even through small forums here in South County, as parents have questions and helping us distribute Narcan. I know that just a couple of weeks ago, we needed more to get it out into our community. So thank you for all that you continue to do to help educate and reduce the stigma around this epidemic. Thank you.
Thank you. And I'll just, we will make sure we deliver this to you, but we do have a resolution here. And I just want to, again, recognize some of the statements in here that in 2020, approximately 108 of our Monterey County friends and relatives died as a result of substance overdose. And that's data from the Monterey County Prescribed Safe Initiative. And reiterate what Behavioral Health Director Catherine Eckhart said, you know, that these are our friends, these are our neighbors, and we all know them, we are all affected by this. So if you are personally impacted and need to get assistance, Catherine, is there a phone number that we have available to have people call if they want to reach out to try to begin a process of getting help?
Rose, do you have the best number handy?
You know, I don't, but I can certainly get it to you. I do have my, there was a distribution about the resolution. I do have my contact information. You can certainly contact me there and I'll definitely get you a number.
All right. Well, I'm going to say call 211 and 211 will get you the right contact information and direct you to the places where we can provide assistance. And I will also mention that our flags and county facilities are lowered to half staff today in memory and recognition of those who we've lost this year. So thank you all for being here. We will deliver proclamation. Your work is important and changing lives. So Supervisor Lopez, circle back to you one more time.
Yeah, sorry, Dr. Close and Dr. Grover have had such an impact on me. I wanted to leave us with one quote, which I took to heart from one of our sessions with them, which was, you know, in a world where you can choose to be anything, choose to be kind. And when I think about stigma, that's the phrase that repeats in my head. And so just remind us all to be kind as we move through this world together. Thank you.
Thank you. And with that, we will say thank you very much and move on to our, we have one final resolution today that we're not presenting, but I do think it's worthy of mentioning, a resolution in appreciation of Susie Brusa for her many years of leadership as executive officer at Rancho Cielo. We do have a signed resolution that we will be getting delivered over to Miss Susie Brusa. So next up, we have items 6 through 10, which are appointments to the many volunteer county commissions and boards and agencies. I'd be happy to entertain a motion to appoint all of these.
Move approval of appointments.
Second.
We have a motion from Lopez, a second from Phillips. Is there any public comment on our appointments this morning? Seeing no hands raised, we'll take a roll call vote on appointments.
Supervisor Alejo.
Aye.
Supervisor Phillips. Supervisor Lopez.
Aye.
Supervisor Adams. Aye. And Chair Supervisor Root Askew.
Aye. The motion carries. Next up, we have consent calendar items 18 through 40. I'll circle around to my colleagues. If there's anything that you wanted to pull for a separate vote, let us know. Otherwise, if you wanted to make comments, now would be a great time for that. And I know Supervisor Phillips had hand raised.
Yeah, I do want to pull for separate action, and I have extensive comments I wanted to make. So on number 25, my referral about TSAL. So.
All right, so we'll pull 25 for a separate vote. Any others? Supervisor Adams?
I just wanted to make comments on 37.
Would you like to make those now?
Sure. This is a comment about a consent item about Laguna Seca. It's a contract. As you all know, Laguna Seca is in my district, and I want you to know that I do keep an eye on the things that are happening there. And I just want to ensure that we speed things along as far as it comes to contracts that we have out there, because it can be detrimental to the success of what we're trying so hard to pull together and make work. So just wanted to make that comment. Thank you.
Great, thank you. Supervisor Alejo?
Yeah, I believe it's number 29, extending the contract with the Bay Area Community Services for the Share Center.
And was that just comments or a separate vote?
Just comments. I obviously we support this. The Share Center has been a success, and we have yet to hear problems associated with the Share Center. So it shows that it is being managed right, and a lot of the concerns that we heard when we advocated for the Share Center have not come.
Third 29. Sorry, there's some confusion up here. Supervisor Lair, sorry to interrupt. I think it's 32 that we're referring to. It's about,
sorry about that.
Yeah, okay, great. I'll let you continue. Sorry to interrupt.
But I did want to just address certain points, because when the Share Center opened, originally there wasn't a direct number for referrals, and the website took you to the Bay Area Community Services webpage, but didn't have anything specific to the Share Center. So the phone issue got resolved. So now there is a number listed so that when people call, there's somebody at the Share Center in Salinas that picks up. So that gives a direct referral and service. So rather than having to be routed through the Bay Area, the number goes directly and gets picked up by somebody here. But the second part, I think there needs to be some on the website, some catering to make sure that the information is catered towards the Share Center. So I would just add that as a suggestion to keep trying to make the information for the Share Center more easily available online as well. The only other things I would ask is that perhaps in 3 months, the Share Center opened in, I believe in May, maybe early June, but maybe in 6 months to get a report on how it's going. The contract calls for quarterly reports about how many people they served, how many people they got into housing. But certainly coming here when we're just initiating this new Share Center to the Board of Supervisors, I think would be important for the public to hear what is working, where are areas that we could improve. I just think that it's that important that I think the community and us and our board would be interested in getting that kind of information of how things have gone on during the first 6 months and how many people were served there. So that would be my request with this item. But otherwise, I'm supportive of it. I want to continue to be successful. And the fact that there's a long waiting list to get into the Share Center really shows that if you have a full service center like this one, I think it brings more willingness from folks experiencing homelessness to be able to come in and get served and receive the programs that could help them get into a better situation in their lives. So with that, thank you, Madam Chair.
Thank you for your comments. And I think we would all appreciate having a presentation about the Share Center. So we'll see about what we can do to get that on the agenda. I have a few items I just wanted to make brief comment on. Item number 33 is an agreement between Workforce Development Board and Pat Davis Design. It seems like a lot of money to me for a website. It wasn't clear in the staff report exactly what special components of the website would lead to a $35,000 annual cost. But I trust that the Workforce Development Board is carefully evaluating that, and if there are ways to provide the web service at a more cost-effective way, that we would be pursuing that. On item number 36, I just wanted to call attention. This is approving submission of 5 entries to the CSAC Challenge Awards. This is a statewide recognition for innovative county programs. And the 5 that we're applying for that I think just are really phenomenal. And I hope that there's ways that we can communicate to the public the incredible work that our county staff is doing. Esperanza Care for Monterey County is a health access program that's expanded to 4,500 residents annually, providing direct access to a primary care doctor with regular care, some limited prescriptions and specialty services. It's an incredible program that's literally changing lives for Monterey County residents. We have the Monterey County Public Health Lab's innovative response to ramp up COVID-19 testing and sequencing. It's just a really incredible that last year our lab brought in a team of college students to assist with the COVID-19 testing and data entry, increasing our ability to do testing from 20 to 120 specimens per day at a time when we really were desperate for that kind of testing capacity. And I think that this is just a phenomenal thing that so many folks in the county, so many of our residents are unaware that the county was stepping up in this incredible way last year. The VITA project we're applying for, this is our community health worker program that's actively deploying testing and vaccinations and information out into the community. We're also submitting for our temporary solution for the pandemic becomes a full functioning 911 backup center. Just the way that our 911 team has risen to the challenges before us and are using COVID-19 as a way to spur innovation and solutions is really incredible. We have a brief summary of each of these items listed on the board agenda, and I would encourage folks to take a look at this and celebrate the incredible staff that we have working. And then finally, the Car Week GIS collaboration, promoting safety, helping thousands who come into our community navigate all the major events. We've got a great team working here in Monterey County, and I just want to give a brief moment to recognize these specific projects and all of the county staff people who worked to make them possible. And then finally, in item number 37 and 38 are Laguna Seca contracts. And I just need to, I recognize that we need to offer these services to support Laguna Seca's success, but I just want to call out that we are, by approving these contracts, we're also recognizing that the operations are operating at a negative cash balance, which we're being assured is going to be resolved by the end of the year. But at this point, I due diligence to make sure that everyone's aware of that. So those were my comments. I will circle back to Supervisor Phillips for, well, should we vote on,
Yeah.
Let's take it to public comment. Is there any public comment on our consent calendar excluding item number 25? Seeing no hands raised, I'll bring it back to entertain a motion.
And I'll second that, but I do want to say that I have a little concern about Lavon Chin's how she coaches or couches these matters dealing with Laguna Seca. And I mean, she seems to go out of her way to take a shot at what's going on there when she's part of the problem. So she's supposed to be there to assist Laguna Seca, and all I have seen, because I've looked into this a little bit, is just obstruction after obstruction. So I have a little concern about how she drafts these reports to make And I didn't see any relevancy of that on what we were dealing with. So I have a real concern of how much support our staff is giving to Laguna Seca to make them a successful operation.
All right, we have a motion for approval excluding 25. I think that was from Alejo. Do we have a second?
I'll second.
A second from Adams. All right, we'll take a roll call vote.
Supervisor Alejo.
Aye.
Supervisor Phillips.
Aye.
Supervisor Lopez.
Aye.
Supervisor Adams.
Aye.
And Chair Supervisor Root Askew.
Aye. We'll circle back, and actually I'll circle back to Charles McKee. Did you have any follow-up comments? I saw you reaching for your microphone.
Just a couple things. One on the CSAC challenge. I appreciate your comments on that. We did. There are really some great examples of the work that Monterey County does, and many of the stars throughout our organization. So thank you for bringing that up. On Laguna Seca, I know that there are different issues going on out there. I know that Levon Chin on just recently last week was trying to help resolve an issue that and getting my signature on a contract that came late to her, and so I know that there's the different challenges out there that she does try to work on, and we'll try to address some of the issues. I think that were there any friction points there, but I think that there's she does work hard. She does I know that there's some differences of opinion about the way things are operated, and we'll try to address some of those going forward.
All right, and I'll pass the mic over to Supervisor Phillips for item number 25.
Yeah, and I'm going to take a little time on this because this is a big issue that's important to my district, and so I did have some questions for staff, and I told them I was going to, because I wanted to emphasize some of the things that were in the report. But Wendy or someone, as I look at this, and I've looked at it, is there any other county that limits a desal to only a public entity? And I looked, I couldn't find any. We talked to Roger Van Horn from Environmental Health, and I couldn't find anybody. And I know I think there's a private owned operated in Carlsbad, and I know Monterey Bay Aquariums is a privately desal, but are we the only one in the state that you know of that limits desal to public?
Good morning. I'm not sure this is on.
It is.
Wendy Strimling, Assistant County Counsel. My understanding from Rick Encarnacion from Environmental Health is that there is no other county that has an ordinance like ours that dictates public entity ownership requirement. But Rick can confirm that. I believe he's on the Zoom.
Morning, board. Yes, that is correct.
Okay. My next question is the ambiguity, I think was pointed out to you, but under 1072-010, construction of a desal plant by a private ownership is allowed. But then when you go to 030, a desal plant can only be operated by a public entity. So if I'm right, a public entity could build one, they just couldn't operate it under this.
A private entity, yes. I mean, I think we've been pointing out in some memos to the board actually for several years now that there is an ambiguity in those two different subdivisions of chapter 10.72.
I know you have. I'm just
yes, I agree with you.
Wanting to
I agree.
emphasize
it seems to me that if you look at the plain language that under the construction permit, that could be a private entity that applies for that, but then the operation is specific to the public entity. That is what the language of chapter.
And as was pointed out to me, the desal under this legislation is defined as something that removes salt from water from drinking or irrigation purposes. It looks like that, and some people have raised the issue. This would prevent a privately owned wellhead desal treatment by industry at the well, like North County. Is that
Yeah, that's outside of my expertise. I will defer to my friends over at Environmental Health on that issue.
Rick?
Supervisor, could you repeat the question? Was it regarding?
Well, in the definition of it, it defines a desal as operation which removes salt from waters for drinking or irrigation purposes. So if someone wanted to remove salt at the wellhead to treat it, would that have to be a public operated entity?
For environmental health, our primary mission is the health and safety of drinking water for people. And I can see there may be, again, a confusion or ambiguity with regard to the code and how that's written specifically that it may impede ag from irrigation. But again, for environmental health and the permitting of desal, we look at it as treatment for water systems, and water systems, again, in terms of protecting the public health.
So if I
But
could
you know,
Rick, maybe as part of this referral, come back to address that issue.
Sure.
So that we get some clarity, because I think that could be a significant challenge that we want to make sure that isn't an unintended consequence of the current ordinance that we have, especially if it stays in place in the current language. So I would, if the supervisor is okay with that, ask them to come back when they come back on a response to the referral to look at that issue.
Because that I didn't pick up on that, but that was brought to my attention by the farming community that weighed in. The other question, in 1989, when this 1017 was drafted, were there state regulations in place at that time to kind of regulate the construction and operation of desal plants?
My understanding that from environmental health is that in terms of water quality concerns, there were not the same regulations that are in place now regarding technical, managerial, and financial capability to run a desal plant. And now state law or state regulation does require TMF, as it's known, so that there's now kind of a redundancy with the state law and this chapter. That this chapter was kind of, far-sighted, but the state has now jumped in and does regulate and does require TMF for water systems.
So presumably in '89, when we drafted this, it was to make sure, like you said, the TMF, the technical management, financial capabilities but how did we get to only, is there a correlation between that and public-private economy?
Yeah, my understanding of the history was, and again, this is a little bit of hearsay because I've heard it from environmental health, that initially it was the concern was that very small projects like would want to have a desal facility, like, very small commercial enterprise, for example, would want to have like just a desal facility for that one facility. And there was a concern that they wouldn't have the TMF, the technical, managerial, financial, to really keep it going in order to have sufficient water quality. So, I wasn't here in 1989, been here a long time, but I wasn't here in 1989, so I don't have firsthand knowledge. But, again, environmental health may want to jump in on that answer. But yes, I think that was a concern
I was here,
back
but
then.
that just blew past me. So I guess my next question is to Rick. If this doesn't exist, if we did away with 1072, what happens now if someone wants to build a desal plant? Who are they regulated by?
There, just like what County Council has mentioned, there are current codes at the state level that address these issues. And even with respects to our local codes for water quality, it's just like any other water treatment that we would regulate for a small water system. So if this code were say like this code never existed, there are current codes, very stringent codes at the state level. And with respects to local small water systems, environmental health would still have a hand in it. even without 1072, because it's a water system treatment, just like treatment for nitrates, arsenic, etc.
Okay. And I guess my last question, and it has to do with preemption. I know in 2012, when 1072 was addressed by the CPUC, the PUC found preemption. And I guess my question is that a risk that we deal with, since the state regulation doesn't demand it be a public entity? Is that a concern have we encountered that so far?
Yeah, I mean, I would say that there are legal issues of concern with regard to preemption. To what extent does the state occupy the field, especially for any kind of water system over 200 connections, and actually anything over 15 that serves more than 15 end users? And under 2 to 14, that's more of a county province of regulation, but anything that's serving more than 15. I will say that 2012 decision was specific to Cal-Am. It was in an administrative proceeding, but in that particular case, our Superior Court has actually also found that the judge rejected a challenge by Marina Coast Water District that the Cal-Am desal was required to get a permit under 10.72 based on the fact that the ALJ for the California Public Utilities Commission had found preemption, and then there was subsequently a settlement agreement that the county entered into. So I think that would be a continuing issue for any water system over 15 or more connections, that we could face a challenge with respect to preemption.
All right. Thank you. Madam Chair, I'm not going to recommend that we follow the recommendation of in the staff report, and I'm not. I think the matter is more urgent than that. They were talking about putting the matter over to October and having further discussions. I want to set the matter for our next meeting, and we checked to see when Wendy was going to be back. But I think the right thing to do is repeal 1072 because frankly, it's no longer necessary. And we now have state regulations in place to protect the public by regulating the TMF as a requirements for these desal. And I think we have to look at this kind of as especially with our drought and our conditions, as an emergency legislation, and time is of the essence. I mean, we started this process in 2018, and I brought the matter on, and it just kind of dropped. And I take some responsibility for that, because I brought that referral forward. And then when the one agency was trying to push to see if they could get by some environmental hurdles, that kind of went away. And then I didn't follow through on that. And so I take some responsibility on it. But in North County, where we have such a problem on seawater intrusion, Casterville is at risk. We're struggling with the farmers to bring more water in for CSIP just this year with the releases from the reservoir being denied, but that doesn't help us with potable water. And Prunedale is on a building moratorium because of our water problems. And just this last week, I met with this nonprofit group, Community Water Services, and they're a nonprofit that has been taking bottled water out on Springfield Terrace and Johnson Road and some other places in our county, because we don't have, we haven't been able to come up with a viable water solution. And I do think there's a real concern on 1072 that it precludes North County growers from treating the water at the wellhead. And that's been raised by, and I do have a question about the constitutionality of something that precludes private ownership and operation. And in looking at this, we have no other utility that is so regulated. And I know Chair was out there with me last week when we had the Vista battery storage facility, and that company has invested hundreds of millions of dollars to improve our power source in Monterey County and beyond. And no public entity would have been able to do that if a private entity hadn't did that. And the way we have this 1072, we're discouraging private companies from investing in our county. And that's what we're supposed to be doing, is encouraging people, especially when you're dealing with potable water and a reliable water source. And I think it is relevant since 1989, where the board encourages desal. 32 years later, we still don't have a desal facility in the county. And I think everybody knows we need a desal here in the Salinas Valley. North County, I think Salinas, the farmers, I have found no one who I've talked to who have opposition to at least opening the door so a private company could come in there if they can afford to build a desal project for us. Whether we have to have, and what kind of environmental review we have to do this, that's beyond my expertise. I was never a good CEQA judge. They kept them away from me. That's why we have people like there. But when you look at what we're doing by getting rid of this or repealing this, it only affects the operation, since they could construct it anyway. And since all the protections are provided by, that was designed for, are provided by the state agency already, and any proposed project, if they wanted to do anything, they would obviously have to go through a CEQA review there. And especially when this is not directed in any one particular project, but I think we want to encourage any and all public or private owned desal projects to come forward. And I'm just worried if we continue on and we keep this door shut to private investment into our county, they're going to go somewhere else. You look at Mendocino now is trucking water into the city of Mendocino because they have a real water problem. So I can see them reaching out and getting a leg up on us on a desal project. So my request, and I don't know procedurally, we'll have to hear from county council, but my request is to put the matter on calendar on September 20 or September 21st, or other direction by the board for my motion to repeal the 1072 and to deal with any CEQA issues that the county council directs us that has to be done. That may have to be done in closed session. I don't know, but that's will be my motion, or is my motion. So. Thank you for putting up with my rather lengthy thought process.
Thank you. Supervisor Lopez.
That might have been record for length of motion. I just need clarity on the motion. Or is the motion to put it on the next agenda or to include that language? I mean, I'm supportive. I need to know procedurally, where are we right now?
Yeah. I'll ask Mr. Gerard
Thank you, Chair, if I might,
how I should count my motion.
I think the motion, Chair and Supervisor Phillips, would be to direct staff, including County Council, to assess the repeal of County Code Section 10.72 in its entirety or in part, and return to the board on September 24th either with a repeal or with an analysis of any environmental analysis that might be due. We have to look at the environmental analysis issue. So if we determine that it's exempt or something like that, we can come back on the 24th. If more work is necessary, we'll need to report back and say we need to do X, Y, and Z.
And just to clarify, I think you mean either the 14th or 21st or the one after.
Oh, which at 21st, I guess.
That would be my motion then. Thank you.
I'll second that.
Okay, we have a motion from Phillips, a second from Supervisor Lopez to ask, I'm just going to repeat just to make sure we're clear, ask staff to return on September 21st with an analysis of the, let's see here, analysis of the option to repeal 1072.
Could I make one
It
clarification?
would be either to introduce an ordinance repealing that chapter 1072 of the Monterey County Code. That would take 2 readings. But if we're not ready because of environmental analysis issues, we will report back on the 21st about the process for environmental analysis.
Okay, so we have a motion, we have a second, and I think, are there any other board comments on this? I do have a few. Supervisor Adams?
Yeah, thank you. I'm a little bit uncomfortable with it because I don't feel like I want to know the background on why the board in 1903 or 1989, why they felt the necessity to bring this 10.72 to code. And while I always want more information, and I'm certainly supportive of getting more information, I feel like I am, before I could vote yes or no to even move this forward without the staff's recommendation as we have it, I need to do some research on my own to figure out, I want to know more about why 1072 came to be at all. So I'm not going to be able to be supportive of it at this time.
So is that information that we could ask staff to bring back as part of the update on the 14th, the 21st?
I think that would be, yeah, I would like to see that.
You would like to ask for that?
Yeah.
Okay.
Yeah.
We looked at it. We couldn't find anything. I talked to Michael Groves, who was working on a project in Sand City, and there was a desal project they wanted to do there, mimicking what they had done at the aquarium. And one supervisor from North County didn't like that particular project and went to Walter Wong, and he passed it. So that's as much information as we were able to get. We pulled out all the stuff that we could get from back in '89. So that's the best I can come up with, because we kept shaking our head. We couldn't figure out why they added that public entity into it.
So maybe we could just have that included in the staff report, any information that we have available to us. And, you know, I think my comment specifically in regards to this board referral, I think there are lessons to be learned from Measure J on the Monterey Peninsula. And I think it's important to recognize that, you know, for the most part, by and large, North County residents really haven't had to deal with private ownership of water. It basically has been public through wells and other private access, you know, personal access, which is essentially public. But by changing this, by allowing private desal to come into our community in North County, we're essentially, I worry, setting North County up for the same fight that the Monterey Peninsula has been just embattled in for a generation now. And I think a couple of points I just want to go on record, and I hope that we can have a discussion. I think we need to have a discussion, but I do hear loud and clear from the community that there is a commitment to finding a shared commitment to finding solutions, water solutions that do meet the needs of our communities, and recognizing that there are different, you know, historical dynamics at play, that there's different water rights at play. And there may be some disagreement about how we get to those solutions, but I do think that there's a commitment from the vast majority of stakeholders to participate in a meaningful conversation. And I think that how we proceed from here in terms of how we build trust and how we work to bring people along, it's going to matter over the longer term. So I would say, Supervisor Phillips, I'm committed to figuring out how we can work together on these issues. And I think that that having staff come back to have a conversation and to bring us some additional information and figure out how we engage our stakeholders to come along with us and identify where those barriers are going to be, where the concerns are going to be, but then work together to move beyond, move past those. I think our residents are looking to us to engage in thoughtful, respectful dialogue and problem solving right now. So I think we can probably figure out, I don't have an advanced schedule in front of me, but I hear we have a motion and a second for a September 21st discussion. And I would just ask that to the degree that we walk into that meeting, that we're prepared to actually discuss the issue and maybe think forward, think about how we can maybe not take immediate action, but find the path where we can bring people along to solution. Otherwise, I just worry we're making many of the same mistakes that we've made in the past. So I can't support the motion that's on the table to ask for a repeal of the code without having that conversation. But it sounds like that may be the direction we're headed in. So those are my initial comments at this point. Supervisor Adams, your hand is up again.
Thank you. Yes, it is. And one of the things that I would want to add into the conversation is really being thoughtful about looking at a regional approach to this, looking at desal that would be able to serve the entire county. And I know that that's like whistling Dixie in some thoughts, but I would hope that we've come to the point of acknowledging how serious the water situation is throughout all of the county, that we could have some thoughtful discussion around finding a solution that would benefit the entire county. And while I really appreciate the situation that you have in North County with CSIP specifically, and I don't want to slow that down, but I cannot help but feel that this might be an opportunity for us to really get beyond a lot of the individual problems that we've had anytime we try to talk about some regional approach to a water solution. And I share your thought that desal is the answer, along with the other projects that we have going as well.
And it is. And that's why I'm trying to do this, so it doesn't get wrapped up with what's happened on the peninsula. And the Salinas Valley is, and North County is not the peninsula. And if anybody, if some entity really can produce the amount of water and desal that they say they can, the one that ought to be jumping on this is Marina. I mean, as well as North County, Marina, which has all its wells into the deep right next to Ramco, where they have their wells in. Of all the people that ought to be jumping on it is probably Marina would be the one that needs it after us. But I think if we have a desal project, I think the city of Salinas, I know I talked to Alco Water. He said, yeah, we can't stay on these wells forever. So, I mean, I think the city of Salinas is another one that would be interested if we ever were able to get desal going here. And as Supervisor Adams and I have talked and disagreed about a number of things, but one thing we agree is we're going to need, in this county, we're going to need a desal project, and it's not sooner than later. We should have had it 10 or 15 years ago.
All right, is there any public comment on item number 25? Okay, we have a handful of hands coming up. We'll stick with our minute 30 for public comment, and we'll start with Kevin Dayton.
Kevin Dayton here, speaking as a private citizen resident of Monterey County. I have not gotten any direction yet from business groups in Monterey County regarding this proposal, but my inclination is that businesses would like to see any sort of flexibility available out there to try to increase the supply of water. I also think you shouldn't have a law on the books that you don't know the reason why the law is on. So if you can't figure out a good reason why that law is there, it would make sense to repeal it. I think it would at least open up those discussions that some of you have mentioned need to occur. I also acknowledge that some people have objections to any private involvement with water supply, and there are people who object on environmental views to desalination, marine desalination at all. So it'll be interesting to see what kind of analysis comes in regarding California Environmental Quality Act, and you may actually get some significant objections to it. But I think this is on the right track. So thank you, Supervisor Phillips, for bringing this up, and the other supervisors for saying, yeah, let's at least keep open the discussion about this as you move forward. So thank you.
Thank you for joining us today, Kevin. Next up, we have Gary Curcio. Gary, got a minute 30 on the clock for you.
Thank you, Chair. Appreciate your recognizing my ability to make comment. I would strongly recommend that the board approve Supervisor Phillips' motion. It doesn't solve all of the problems. It doesn't even make a decision, but it's a start. We really need to begin taking this water situation way more seriously than we have. Some of us have, and many of our residents have not. It gets more dire by the day. We're going to have another drought this winter. We need desal desperately. I completely agree with Supervisor Adams when she says maybe it's time to take a look at another regional project. And MCHA would be very much like to be part of that discussion. But we need all the water that we can possibly produce. We have no guarantees that the M1 expansion is going to be successful, and we need to find any amount of water we can find. I would urge this board to at least approve Supervisor Phillips' motion and get the ball started. Thank you.
Thank you for your comments. I don't see any other hands raised, and we don't have anyone with us today in chambers. So I will close public comment on item number 25. We'll bring it back to the board. We have a motion and a second. Is there any further discussion, or I guess we can move forward with a roll call vote? And I'll just mention, we've pulled up the advanced agenda. The 14th is absolutely packed with critical housing issues. We do have some items we can rearrange and push out in regards to making space on the agenda for the September 21st. So we'll work with the CAO since that is included in the motion. We'll ask for a roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Lopez?
Aye.
Supervisor Adams?
No.
And Chair Supervisor Root Askew.
Yeah, I'll also be voting no on this. I support bringing this back. I think we need to have a conversation. I'm just deeply concerned about not including critical stakeholders as we move forward. I think that we'll be making a big mistake. So with that, we vote motion carries 3-2, and we will hear this item again on the 21st of September, likely in the afternoon. All right. It's 11:44. We've made our way through consent calendar. We are going to move on to general public comments for items not on today's agenda. If there's any public comment for items not on today's agenda, please raise your hand so that I can call on you. Seeing no hands raised, we will close public comment for items not on today's agenda, move on to our 10:30 a.m. scheduled matter, which is item number 12, to approve district appointments of alternates to the 2021 Advisory Redistricting Commission for a term ending December 31st, 2021. We've got Rosemary Soto with us, and I will pass the microphone over to you, Rosemary. Thank you.
Hi, good afternoon, or good morning still, Madam Chair and members of the board. It's my pleasure to be with you this morning to share a brief update on the Advisory Redistricting Commission. You know, last month on July 27th, your board appointed 3 representatives to serve for their respective districts, and we now have a total of a 15-member commission. that serves as the Advisory Redistricting Commission. Just a couple of weeks ago, last week, the commission approved a schedule of regular meetings, and they will be meeting on the first and third Thursday of every month. The regular schedule of meetings is in addition to community listening sessions or public hearings. And being, as you are aware, that we are working within an extremely tight timeline with many critical tasks that we must accomplish to be able to meet our ultimate goal of having a final plan for you to adopt by early December. It really is imperative that we consistently meet quorum. And it's recommended that the board approve the appointment of an alternate representative for each district to ensure that quorum is met at all commission meetings or public hearings. So supervisors have nominated alternate appointees from the same pool of applicants that were received and reviewed during the commission application solicitation process, which concluded in July, on July 19th to be specific. Supervisors also did have the option to remain without an alternate appointee. So some of the terms of the what is expected of the alternate appointees would be that they are encouraged and have the ability to engage in all meetings, including those that have met quorum with the appointed commissioners. And in those cases, with their attendance there, they will be encouraged to participate and engage, but will only have a vote on action items during meetings where they are attending in the absence of the appointed commissioners. So in your agenda packet, you do have a list of the nominated alternates from each of the supervisors. For District 1, we have Ms. Vanessa Robinson. District 2, Sister Rosa Dolores Rodriguez. For District 3, there will not be an alternate. And then for District 4, we have Terry Short. District 5, Keely Richter. In District 3, we have a resignation that has left a vacancy for District 3 as of August 25th. And so the pool of applicants that came through for District 3 has been exhausted, and there are no alternate options for an appointment to fill the vacancy. So a constituent of District 3 has been nominated by County Supervisor Chris Lopez, and that will be Simon Salinas. I should say former Supervisor Simon Salinas. So the nomination is also included for an appointee for District 3. So with that, that is in essence the whole my update for you this morning, and that is a recommendation from our office to you. Thank you. I'll take any questions or comments.
Thank you, Rosemary. Let's see here. We're going to start with Supervisor Adams.
Thank you, Rosemary. I have one question, and it's a quick one. I think I heard you say, but just can you please confirm whether in addition to the alternates, the public is welcome to attend the commission meetings?
Yes, absolutely. All meetings are subject to the Brown Act, and they are made public. And then certainly, of course, public hearings are intended for the public as well.
Okay, thank you. And then can you tell me where the meetings will be held and if they will be both by Zoom as well as in person?
Standard regular, the scheduled meetings are held by Zoom. And we have a Zoom link that is available on our redistricting webpage. The schedule of all of the scheduled meetings are there along with the Zoom links. And then shortly after each meeting, there are minutes that are posted and any relative information that is shared during those meetings.
Thank you so much for that.
Any other questions? Supervisor Lopez.
No questions, Madam Chair. We just move staff recommendation.
Second.
Right, we have a motion from Supervisor Lopez, a second from Supervisor Alejo. Is there any public comment? Seeing none, we'll close public comment. Oh, we do have one. Pardon. Janae Jarvis.
Can you hear me?
We can. Thank you for joining us today. We have 1:30 on the clock for your comment.
I don't have access to your agenda that you have today, so I was just wondering if this is a public comment about what she was just speaking of, or just a public comment in general.
The public comment, general public comment has closed, but this is a public comment on redistricting appointments for the 2021 Community Advisory Redistricting Commission.
Okay, I have no comment then.
Okay, thank you. We'll move on to Margie Kay. Margie, I've got a minute 30 on the clock. Thank you for joining us.
Thank you. I just have one question. The report, the written report, nor the oral report given by Ms. Soto, it doesn't say who's resigned from District 3 as a commissioner. Is that, can we know who that is, or do we have to wait for the next meeting to see who's not there?
I'm happy to respond, Madam Chair. I did receive a resignation from Mr. Ron Eastwood, a resident of Spreckles.
Thank you.
Great. Thank you for your comments, Margie, and thank you for joining us today. Seeing no other hands raised for public comment, I'll bring it back to our board. We do have a motion and a second. Supervisor Lopez, your hand is up.
Legacy hand, my
okay,
apologies.
Perfect. Got it. Very good. We'll take a roll call vote. Thank you.
Supervisor Alejo.
Aye.
Supervisor Phillips.
Aye.
Supervisor Lopez.
Aye.
Supervisor Adams.
Aye.
And Chair Supervisor Root Askew.
Aye. And again, just big thanks to all of the community members who are volunteering their time to serve on the redistricting commission. And I encourage anyone who is interested to take advantage of the opportunity to tune in and watch the conversation and the information as it gets shared in these public meetings. With that, the motion carries, and we are right on time to recess into closed session for lunch. We will be reconvening back here at 1:30 for our afternoon agenda items. Thank you. We'll see you then. Pulled it back in.
Thank you so much, Irma, and good afternoon, Supervisor Chair Askew and members of the board. Thank you for the opportunity to bring this item to you this week for additional information. I'm going to go ahead and start the PowerPoint. So the purpose of this study, as Irma mentioned, it is a provision
All right, everybody, welcome back to our afternoon session for Tuesday, August 31st, the Monterey County Board of Supervisors. Could we get a roll call from the clerk, please?
Good afternoon. Let the record reflect all supervisors are present, with Supervisors Alejo and Lopez appearing via video conference and Supervisors Root Askew, Adams, and Phillips appearing in person.
Fabulous. And I'd like to welcome Maria Avila as our Spanish interpreter today. Maria, would you make our Spanish interpretation announcements?
Buenas tardes, mi nombre es María, estoy aquí para los servicios de intérprete en español.
Thank you. And just for the record, anyone who would like Spanish interpretation services, we do have those available in chambers as well as on Zoom. For anyone who's watching us on Facebook or YouTube, you're welcome to hop over to join us on Zoom at webinar ID number 224-397-747. I'd just like to thank everyone for following county ordinance to wear a mask while you're in the building. We really appreciate that. And also want to, we are trying out some new technology with pinning of videos to the screen. So just like to invite my colleagues to show respect by having your cameras on during our conversation today, and ask for everyone's patience with our new timer technology that we're using for public comment. So thank you. We do have a 1:30 scheduled matter, which is to take action to adopt or provide direction concerning a COVID-19 related face covering mask mandate for Monterey County. I would like to invite Charles McKee and Les Gerard to take the microphone from here.
Thank you, Madam Chair. Appreciate the opportunity here to talk about the potential for instituting a mask mandate to address COVID-19 in Monterey County and the cases mainly associated with the increased cases with the Delta variants. As you know, and as you mentioned, the County of Monterey did institute a mask mandate for county facilities for both employees and the public. And many other jurisdictions, as well as many in the private sector, have decided to do the same. My understanding statewide, there are some initiatives. I understand that the state itself has put in some of the same mandates, and then now they've pushed those down to the school systems. And those are some of the measures that the different organizations, different entities have decided to put forward. We also know that there's a lot of disagreement over it, and what is the best course of action can sometimes be in the eye of the beholder. As obviously, this is one of those times where people have differences of agreement here. The option for the county to do a mask mandate countywide is something that we've heard from members of the public. I know the board members have received a lot of communication on this. We've also received communication from different public entities that they think it would help them if the county did one, county-wide, as opposed to each individual city as well as the county, which is also an option. The cities could do it if the county can do it. It's kind of a police power thing that I'd let Mr. Gerard talk about. In addition, the issue about whether to do one countywide is something that will also involve enforcement and some of the challenges associated with that. But we know that there are a lot of businesses out there that would like the ability to say, look, this is something that is being required by the county, and it helps them in managing the situation. Because right now there's kind of this unknown: is it required? Is it not required? Can a business do it? Can a business not do it? And so some of those issues might get resolved, but understanding that there is some difference of opinion, that we want to make sure that everybody's voice is heard as far as the opinions here. And so the board had asked, there have been requests by the board to put this on the agenda, so that's why we're here. We want to make sure that we do it in a way that's transparent, and so it may not be something that gets immediately adopted today, but it could be, and we'll talk about that with Mr. Gerard, or you may decide that it's appropriate to hear it and then come back at a future date to enact something if you so choose. So I will turn this over now to County Council Les Gerard.
Thank you very much, Honorable Chair, members of the board. As you may know, in August, a number of counties in the Bay Area, including Santa Cruz County and the cities of Berkeley and Benicia, adopted mask mandates for their citizens. The My staff has drafted an ordinance that would impose a mask mandate in Monterey County. And pursuant to an attorney general opinion, that mandate would apply in all of Monterey County, including the incorporated and unincorporated areas if the board so chose. We're not prepared to present that ordinance today. It hasn't been disclosed to the public, and there are a couple of issues that we would like some direction on. And let me just describe what the ordinance does and talk about the type of direction that we need. First, the ordinance implements a mask mandate indoors, except for certain exceptions. If you're in your own residence or working in a closed room or office alone or with members of your household, if you're actively performing an activity that cannot be done while wearing a face covering, for example, actively eating or drinking, swimming or showering in a fitness facility, or obtaining a medical or cosmetic service requiring removal of a face covering, for example, dental work. Also, if you're specifically exempted from use of a face covering by guidance issued by the California Department of Public Health, all businesses would be required, and government entities that own, operate, manage, or occupy indoor facilities would be required to implement or enforce the face covering mandate and post appropriate signage. There are some definitions about what a face covering is, what a business is, and personnel to whom it would apply, which means basically employees or customers coming in. So the things that we need some direction on is, for example, what age below which the mask mandate would not apply. There's a number of different ages out there. I've seen 12, I've seen 4, I've seen 2. So we would need some board direction on what age below which the mandate would not apply. Enforcement, a violation of the Monterey County Code is a misdemeanor or an infraction at the discretion of the prosecuting attorney. They may also be enforced through an administrative citation process. So the board would need to direct whether we make a violation of this ordinance a misdemeanor or infraction at the discretion of the district attorney or subject to administrative citation proceedings. And termination, how long do you want it to apply? Do you want it to apply until rescinded by the Board of Supervisors? Do you want it to apply until a date certain or until the happening of a specific event? One of the samples that I think we've seen made it applicable until rescinded or until that particular county went from the red CDC tier to the orange CDC tier, which has to do with your positivity rate. So these are some things that we would like some direction on today, if possible. And then we would recommend that you perhaps schedule a special meeting, at which case the ordinance could be adopted as an urgency ordinance, which would be effective immediately. Happy to take any questions or receive any direction.
Thank you, Les, and thank you, Charles, for the research and the information. Do you happen to have a copy of the draft available?
Not for distribution yet.
Not for distribution at this time. Okay. Okay, well, let me take it over to my colleagues for any questions, and then we can bring it out to public comment, and then we'll bring it back to the board for action. So we'll start with question, Supervisor Alejo.
Yeah, thank you. Just on the timing, I'd be, if it's permissible, I'd be willing to be able to move forward on a mask order today, knowing that we could provide several days for the ordinance to go into effect. That's what Santa Cruz County did. That one was done by the health officer. Ms. Newell, I believe her name is, and it gave a certain amount of days for that to go into effect so that businesses could prepare for its implementation. But that order was also similar to, I think, the other 7 or so Bay Area counties that had made that order effective August 3rd. So on the question about what age would be appropriate to have the mask be in effect of, I would ask our county staff, what was the age in the Santa Cruz County health officer order, which I believe also mirrored the other Bay Area orders. I think that would be guidance so that we're not just picking an arbitrary age number, but can look to those orders for guidance about what's the appropriate age amount.
My recollection is that was 12 years and above, but I can confirm that here shortly.
All right, so we'll get that information on its way to us.
If I may, Chair, on the question of process, unfortunately, Supervisor, the ordinance is not final. It can't be adopted today. You would have to come back, give us direction to finalize it, and then hopefully be able to schedule a special meeting where it could be introduced and adopted on the same day.
So then the question is, how soon can we call for a special meeting to be able to act on this? So that's where I would ask. Looking at our calendars, if Friday doesn't work for all of us, could we look? I know we have to do it at least 24 hours in advance, so maybe we might be able to find a time on Thursday so that we could have all 5 supervisors present. Oh, the alternative option would be then to wait till next Tuesday, where we normally have meetings, except because of Labor Day, there's no meeting scheduled for next Tuesday.
Okay, so we're going to get some information back about the age that Santa Cruz ordinance is. I hear you, Supervisor Alejo, suggesting Thursday or Tuesday for an emergency meeting. In terms of enforcement and termination, those were the other 2 questions that I think were posed. Did you want to weigh in on those as well?
Yeah. My thought is that we're not doing anything new here. Our county has done this before with the indoor mask order, and we created similar administrative procedures to be able to cite offenders. And also, I believe the proactive work from our district attorney's office also conveyed to the public that there was some teeth behind the ordinance in terms of the enforcement, and it didn't require a lot of different cases. It was a few high-profile cases that really conveyed to the public that there is enforcement upon these orders. So I just want to reiterate that this is not something new we're talking about. We are seeing an upswing in infection cases statewide, and I think we're just trying to resort back to what our public is familiar with, what we've done before, and not trying to create anything new that our residents are not familiar with.
Okay, other comments or questions from my colleagues on the board? All right, well, I will make a few and then we can go out to public comment. And I thought we would maybe be receiving some information from the health department as part of this presentation as well. But so when I look at the data here in Monterey County, we have approximately 94,000 children between the ages of 0 and 14. You know, those 12 to 14-year-olds are eligible to get vaccinated, but the majority of those children are not even eligible to get vaccinated at this point. And if you look at our data, 60% of our Black residents remain unvaccinated at this point. And when I look at the new information that the health department is now posting about COVID rates among unvaccinated, it's showing us that those rates among unvaccinated are significant at 25 per 100,000, and that's over a 7-day average. If we were looking back to last year when we had the state criteria, that would have put us into the exceptionally high rate of transmission. So essentially, those are our children and remaining unvaccinated who are in that very, very high category of transmission. And as much as I wish that there was a simple solution to get us out of this pandemic, I think we can all recognize at this point that it's going to take multiple layers of protection. And I'm so proud of the work our community has done to get everyone vaccinated. You know, we're hitting, you know, over 90% in some of our communities, which is incredible. And I know that that work will continue. But it is frustrating as a parent to learn that this virus is still being passed from vaccinated people to unvaccinated. However, we do know that masking does reduce transmission. And just as a parent and as a friend of other parents and families, it really feels like since the start of this pandemic, families have been left behind at every policy decision. We were literally talking about golf before we were talking about children last year. Bars and gyms were reopened before schools were reopened. I'm not blaming any of this on our local health officials or our local health response, but across the state and the nation, parents and children and families were left behind. So when I look beyond the health specific data about hospitalizations and testing positivity, I'm looking and hearing about the stress and chaos on families that is overwhelming. The weekly notifications now that our kids are back in school, that your child has been exposed to a classmate who tested positive for COVID is pushing the families that I know to the edge. We're hearing about testing shortages at the state, and we're hearing that our hospitals have nursing shortages that threaten care. Our kids have returned to school, and I really feel that it is imperative that I do everything in our power to protect their physical health, to keep them in school, to help their parents get back to work, to limit the ongoing trauma that comes with constant exposure to cases of community spread. So I am here to say that when I look at the full range of data available to us, I'm pleased to hear, Les, that we have an option for this board to move forward with an ordinance that would apply to all of the cities in our county. And I would like to see us move forward with that. And I also want to recognize the many communications that have come into our office from people asking us to take additional steps to increase the layers of protection that are available. We've also heard from people who have concerns about, the additional, not wanting to have additional county mandates in place. And I hear all of that. But at this point, I think that we need to move forward and take the steps that we can to prevent the spread of this virus and keep our community as healthy as possible. So those are my comments. I'll circle back to my colleagues and then we'll go to public comment. So Supervisor Phillips.
Yeah, I support it, and none of us like to wear a mask, but it's something that we know has proven to be effective. My wife is going to keep wearing a mask after this. We've been healthier than we have in the last year and a half, unfortunately, for the circumstances. And I do think if we're going to do it, it shouldn't be just in the county. It should be the entire county area, just not the unincorporated area. It was pointed out by when I was talking to the president of Pebble Beach, and he was pointing out with tourists coming in, we give missed messages to them if they go to Pebble Beach or Quail Lodge, they're enforcing the mask, and if they go to Monterey or Seaside or somewhere where they don't have the mask thing, it's a problem. And I did notice that we just received a letter of support of a countywide mask, and it had elected representatives from Carmel, Marina, Sand City, Delray Oaks, Pacific Grove, Greenfield, Soledad, Seaside. So I think we do have the support of the cities, and I think it's a way so the businesses, that's the rule and that's the order, and it gives the business protection when they're asking people to have a mask. And I was this weekend I was down in Santa Barbara County and in San Luis Obispo County, and every place you went in, you were expected to wear a mask, and if you didn't, they had some masks there for you, and I saw no problem in how they were enforcing it, and it had to be a countywide thing down there. So I would support the motion. Thank you.
Thank you. I'm not sure we have an actual motion on the table yet, but the concept. Supervisor Adams.
I support the concept as well. And we've heard from so many people throughout the district and throughout the whole county, actually, and all of them are asking us to come forward with the mask mandate. I think we've received just a small handful of requests from people asking that we do not do so. When I met with the 3 mayors from the District 5, everyone agreed that it should be countywide, that it would be terribly difficult to either enforce, and it would be confusing to visitors if we had one for the unincorporated area And then each of the cities was left to do it on their own. So I'm completely supportive of having a countywide mask mandate. Like Supervisor Phillips, I was in the Bay Area in San Francisco, and everybody's wearing a mask anytime you go inside any place. There, it's even more severe in the sense that you have to show proof of your vaccination before you can get into a restaurant. So I know that that's not uncommon throughout California. I'm not recommending that we do that here, but I do feel that having a mask for all of us to wear would be good. The only comment that I make, I think it would be helpful if we would be able to give the cities enough time to ensure that they can inform their city councils and they have the opportunity to provide some input, in whatever way that they need to, as they have in the past. I think that would be great. And again, as Supervisor Phillips said, I spoke with, the largest employer that we have in District 5, the Pebble Beach Company, who are supportive of this and felt the same way, that there has to be a all or nothing kind of thing for all of us. And my guess is, as I look out at the audience and seeing all of us sitting here masked, I think people would probably be, most of the people in this room would be supportive of having the small time inconvenience or short time inconvenience of wearing a mask than the long time inconvenience of seeing this drastic Delta variant just spread throughout the county. So my hope is that people who hear us today will take this message to heart. And even if you're not mandated to wear a mask, for your own protection and that of those whom you love, go ahead and start wearing a mask now. I think it just would be a prudent behavior on our part. So thank you.
Supervisor Alejo, did you want to comment again before we go to public comment?
Yes, and it was a question for Dr. Moreno, and I'm glad we clarified, because before last week when we brought up this item, we thought that if without Dr. Moreno's order, that he was only empowered to be able to issue that countywide ordinance, and because of the research of our county council and the opinion from a past attorney general's opinion and a court case, we now believe that we are solid legal ground to be able to initiate an order that would apply countywide. But I did want to give an opportunity to Dr. Moreno as our county health officer, because I know the press and the community would say, why did the board act and not our health officer, when Santa Cruz and all the other Bay Area cities, those orders were implemented by the county health officer. So my question for Dr. Moreno would be, why would he not be willing as our health officer to be able to issue this order, knowing that the data that was just put on our website showed that unvaccinated residents have a rate per 100,000 of 24.2 of being infected, versus if you're vaccinated, it's 0.7, less than 1%. And in terms of hospitalizations, unvaccinated residents is 1.7 per 100,000, whereas vaccinated residents is 0.3%. So those numbers are numbers we've been asking for. It's new data put on our county COVID data website, but it really shows the difference in the risk between vaccinated and unvaccinated residents. And then we heard the case in Marin County where a teacher who was unmasked and unvaccinated infected half of his classroom. That's only in one classroom, one unvaccinated, unmasked teacher, putting young children at risk. But I think if we don't hear from our health officer on this question, I think there's going to be questions from the community that why didn't Dr. Moran want to issue an order? So I thought this is an opportunity for him to be able to do that.
Do we have Dr. Moreno on the line with us?
Yes, Chair, I'm here.
Fabulous. All right, we'll pass the microphone over to you.
Yeah, sure. Thank you. All right. Good afternoon, Chair, board members. So a lot of good questions and comments, a lot of concern about COVID. Essentially, as the health officer, my obligation is to look for or assess the status of communicable diseases in Monterey County, among other things. And so in order to assess as well as I can, I need to be able to analyze data. And if I determine as health officer that communicable disease is spreading, I do have the authority to issue health officer orders. That authority does come with some requirements and criteria that I have to follow, which is different than anyone else in the county. And so I have to base my decisions on the data that is presented to me and the quality of the data. And so in order to issue an order as a health officer, I have to be able to demonstrate that other measures, often restrictive, but other restrictive measures have proven ineffective in achieving the desired outcome, which in this case would be a reduction in the spread of COVID-19 in Monterey County, which is my jurisdiction. And so looking at the data here in Monterey County, our team has determined that for the last 2 weeks or so, there's a statistic we use which is R effective. The R effective base is an indicator of transmission, and the R effective has dropped down significantly to about a level of 1. And when it gets to 1, it means that transmission has slowed to the point that it's no longer increasing in Monterey County. It's not decreasing either, it's no longer increasing. And so the transmission is steady. And so that's one that we call a lead indicator in terms of assessing where we are in the pandemic, in particular when there's surges of the virus. And so that's a very reassuring statistic that we're now seeing. And it's also dropping, actually it's below 1 statewide, which is a trend now for the past, I think, 2 to 4 weeks, which is a good trend. The other thing is that we look at another leading indicator, which is the positivity rate. And so we know that in California, the positivity rate has been dropping, I think, for the last month. And here in Monterey County, it's been dropping. And our team has determined that it's been dropping now for a couple of weeks. So that's a pretty consistent trend. So that's another indication that the transmission is decreasing here in Monterey County. And then we look at the next thing is the case rate. So when the positivity rate starts to drop, the case rates start to level off and eventually start to drop. We've noticed that in California, the case rate has been dropping for at least a couple of weeks. And also that in the Bay and coastal area, which Monterey County is a part of, it's been dropping now for 2 to 4 weeks, depending on which counties to look at, but definitely leveled off about 2 to 4 weeks ago, and now decreasing. And as a region, the case rates are dropping. In Monterey County, we've been lagging about 2 weeks from some of the other counties in the Bay Area and in California, but it's been consistent. Our positivity rate started dropping about 2 weeks after the states did, and our case rates have leveled off about 2 weeks after other counties, and the case rates have been leveling off. And so we looking at that, and I think about what combination of strategies have fortunately resulted in a slowing of the transmission of the virus. It's been a combination. I think it's been a state health officer order that requires universal masking in schools to prevent transmission among students and teachers. It requires universal masking in hospitals, healthcare centers, outpatient clinics, skilled nursing facilities, a variety of shelters, a variety of places where the most vulnerable people are to COVID are congregating or living or visiting. It's a combination of the vaccine rates. We have some of the best vaccination rates in the state, and it continues to increase. So we have a variety, and also the health officer, my health officer recommendation that everyone who's indoors, regardless of vaccine status, should wear a face covering. And so those different layers of somewhat restrictive strategies in combination, which are less restrictive than an actual universal face cover mandate, have, from what I can tell, have proven to be effective in slowing down the spread of COVID-19. So as a health officer, I can act if I feel that less restrictive measures are not effective. But in this case, the less restrictive measures appear to be effective at slowing the rates, so it'd be difficult for me to justify issuing a health officer order.
And Dr. Moreno, it is hard for some of us to hear that, knowing that there's similar data in the other Bay Area counties, including our neighboring Santa Cruz County, and the health officer there, Gail Newell, issued an indoor mask order just 2 weeks ago. And the other Bay Area health officers just a few days prior to that. So what is going on in their counties that or their health officers are willing to take a bold position and reissue that indoor mask order, and you are not. I look at our numbers and they're alarming. We had over 120 new cases today, 84 new infection cases yesterday, and the numbers don't seem to be. They seem to be going up. Looking at our charts that are posted on our website, rather than plateauing, as you say, or going down. We've had 46 deaths since June 30th. 46 deaths too many in Monterey County. So, and then I look at the reported Delta variant cases that we've been monitoring on a daily basis from 14 in mid-August to over 300 today. Those numbers should be concerning to everyone. And I think a message saying that we're plateauing or things are getting better while we're seeing dozens of deaths of residents and over 100 cases today of new infection cases, I think is alarming and should have us take more caution rather than letting our guard down and not taking necessary measures at this time where there is significant concerns, at least for me. I just needed to put it out there, but I know my concerns are expressed by many about why you've been unwilling to act when your colleagues have taken such necessary steps to protect their county residents.
All right, are there any other board comments or questions before we go to public comment? All right, let's take it out to public comment. Oh, I'm sorry, Les?
Thank you, Chair. I just want to make a brief comment about the authority of the Board of Supervisors here. And Dr. Moreno has described the analysis he has to go through and the authority that he has to issue an order. And in his discretion, he has determined it is not yet time for him to issue an order. That does not mean that this board, in its discretion, considering the current statistics,
I think we lost volume here, and people are jumping off the Zoom.
It froze. It looks like at the county side.
Okay, so I think we lost most of Les's comments there.
Yeah, everything. I'm wondering if we should all log off and log back on. I don't know if that'll help or not. I have no idea.
Wendy, are you able to hear us? Yeah, I think Madam Chair can't hear us either.
Greg, just for our folks on the internet. Greg, just for our folks on the internet.
Got it. 5-minute IT break. Thank you.